morning, good afternoon, good evening. I'm delighted to welcome you to this session of the PMAC 2021. You're well aware of the title, of course, Governance for Public Health and Pandemic Preparedness. What have we learned since the beginning of the pandemic? And of course, when this session was planned, I think, had hoped that we would be further ahead in being able to fight the pandemic. But as you know, many countries are entering a very critical phase and are in what some call a third wave. So all our speakers who are heavily involved in the response will be able to tell us what experiences have been gained and what lessons we have learned. You have already seen who is joining us for this discussion, an extraordinary group of speakers, and I'm particularly delighted that they basically represent three continents, so we can build on many different experiences. We hear from Asia, from Europe, and from Africa. All our speakers have global experiences, have regional experiences like with Europe, with the African Union, and they have national experiences. And that, of course, is part of the objective of this coming together, that we can look at lessons that have been learned at different levels of governance. We have the global perspective. Dr. Suzuki is with us from the Global Preparedness Monitoring Board, but of course with extensive experiences also with G20, with the Japanese response. Dr. Kluge, as the Regional Director of Europe of WHO, brings the experience of over 50 countries that he will share with us, but also the question of cooperation with regional organizations like the European Union. And Dr. Raballo has an extensive experience in Africa and at the global level, and of course now coordinates the national response. So the way we will be approaching this is that we will hear from the speakers, we will have a discussion. I would like you to send questions to speakers during the session. Please use the question and answer function and type your question, and I'll try and keep on top of this and select some of the questions. Dr. Kluge will leave us in about an hour, so I will try and make sure that questions to him can be answered before he leaves us for his other duties. And if you miss any part of this session because you have to go out or you get a phone call, rest assured the session is being taped and it will be available to you on the PMAC website so that you can re-listen to some of the issues. As I've said, we hope in this session to extract, as it says in the objectives, 3 to 5 lessons learned about governance at the different levels of governance. And I think one of the things we have definitely learned is that we are learning all the time. This virus is changing, the responses are changing, governments are challenged, science is challenged. But if there's one thing from my perspective, and that's not surprising because I'm a political scientist, one thing we have learned is just how political pandemics are. And many of you know that countries that were analyzed to have a very high level of preparedness because it seemed that they had strong institutions, strong science, fantastic professionals, that even those countries have failed in their response in many aspects, partly because of political decisions that were made. We also have the experience that some countries use the pandemic for political purposes. And we do know that no longer is it easy to say one type of government, one type of political system is better at managing the pandemic than others. This is also something we are learning. So we hope to find out a little bit what makes the difference. Before I ask the speakers to give us their presentations, I would like them to share with you, to make it also a little bit more personal, not just hearing them talk, but to hear from them, you know, how exactly they were involved in the pandemic response. I mean, obviously, it seems obvious that a regional director has to be involved in the response. But if you could give our audience a little bit of a feel, what does that mean? How has that changed your work? And to what extent do you feel you were prepared enough for this? Hans, can you share that with us? You became regional director. I don't think you expected to have to deal with a pandemic.
Thank you so much, Professor Kikbush, dear Ilona, and also my colleague panel members, Dr. Suzuki, Dr. Raballo, for this opportunity. So to go straight to the introduction you're asking, Ilona, absolutely. In fact, I became the region director in the WHO European region, which encompasses 53 European member states, including Central Asia, Israel, going to Vladivostok, almost at the same time when the coronavirus entered Europe and made it the epicenter of the pandemic. So, was I prepared? I think, if we're honest, very few people or organizations were prepared for the devastation and the size that it brought with it. But what I learned is that you never know what in the past can help you for future challenges. In concrete, for me, the experience I had working 5 years with MSF, Médecins Sans Frontières, in some of the most difficult circumstances and acute crises in different continents in the world was tremendously helpful to be a crisis manager. So one of the first things I did is to re-profile the whole regional office, all the 700 people, to have all hands on deck for the crisis. Some people were wondering whether it was too early, but it was one of the better decisions, because what I learned in a crisis is always imagine the worst and start from there. If it's not that worse, so much the better. But in this case, it definitely was. I believe, Ilona, that if that's fine, I will mention some reflections, right? And then we go, and knowing Ilona, who I respect very much, I know that you always want to make it rightly so interactive. So I thought, rather than to read a statement, I have a number of points which I thought about the last days.
Thank you, Ilona, for having me and for that question. I want to welcome my fellow panelists as well. Happy to be here. For me, it was a mixed feeling and a mixed experience. I was the Minister of Public Health when COVID struck. We didn't think it was going to become a pandemic. I felt I was prepared for what we thought it could be, then realized I was totally unprepared for what it became. And I guess this is what rich and poor countries, individual scientists, policymakers found themselves in such a situation. I think COVID challenged every foundation of government, of science, of institutions, politics, and everything. You said, Ilona, pandemics are highly political. I would say public health is highly political and highly politicized. From my experience dealing with Ebola when I was in Ghana, I thought I had all the competences and the skills and the thinking that you would need to mount a response. But then that was before COVID came, just to realize that the extent to which it touched in the economy and social structures of our country and many other countries around the world, and the way it challenged the regional and even the intercontinental politics, the geopolitical issues that arise around COVID make us think that, at the risk of stating the obvious, we are never prepared.
Thank you, Magda. Dr. Suzuki, how was that for you personally?
Thank you, Yona. I'm very happy to be here. Together with Yona, I served as a member of Global Preparedness Monitoring Board for the last 2 years, and I'll be speaking about it later. But at the same time, from January to August last year, I served as a Secretary General of the COVID-19 Task Force within the Ministry of Health Japan, covering the ministry-wide programs for testing and contact tracing policy and hospital beds preparation. Although the mortality due to COVID-19 per 100,000 population in Japan is very low as compared to US and European countries, it's about 130. I feel that capacity of public health infrastructure was somehow overwhelmed by the magnitude and speed of the pandemic. Even though we reviewed to 2009 H1N1 novel influenza, and we underlined the importance of public health infrastructure at that time, but we haven't done anything homework for the last 10 years. So that's a pity for me.
Thank you very much. So, dear audience, I hope you got a little bit more of a feel for the people that are here on that panel. And everyone, of course, plays their professional role. Everybody brings their experiences to a crisis. And as we heard, on the one level, one can be prepared, but one is never fully prepared. I'm thinking of one thing we had discussed at the Global Preparedness Monitoring Board. We're always prepared for the last crises. And that is something I think Magda alluded to, all the experiences she had with Ebola, but that could not apply in the same way to COVID-19. So thank you for being open about this and sharing this. Hans, I come back to you now, and you were going to share some reflections with us on the learnings in Europe, for perhaps also WHO and the countries in your region.
Thank you. Thank you again, Ilona. Indeed, some reflections here, and I'm very keen to hear the feedback. So, one of the things we definitely learned here in the COVID-19 pandemic is that the actions of one country can have profound consequences on the actions of another, while the mechanisms to address actions by sovereign governments that threatens others are in fact very limited. So no country is an island. At the same time, I think we have to recognize that countries of the world did recognize the need for some degree of international public health governance linked to crisis. For example, the international health regulations, also the European Union, but we all know that those have the limitations. And of course, we should first and foremost remember that the governments of the world, all the governments, committed to the Sustainable Development Goals. At the same time, governments did agree to pool sovereignty in a number of areas related, for example, to security and human rights. So it's not that there is no precedent. We also acknowledge that the international response to the COVID-19 pandemic was fragmented and uncoordinated. And we saw this also in my region because it's 53 countries. You have the EU, but you have then 26 countries outside of the EU. So this was quite obvious. So the question that we are asking ourselves now is how to improve global health governance and response to future health crises in a way that is sustainable and can ensure real international collective action and effective multilateralism for health, because we strongly believe in multilateralism. And that was one of the reasons that a couple of months ago, I decided to establish the Pan-European Commission on Health and Sustainable Development to rethink policy priorities in the light of pandemic, with the ultimate output to have targeted recommendations, not too many, 5, 6, 7 big recommendations, pragmatic, on how to invest in health and social care systems. And this commission has 19 leaders, political, financial, economic, social, policy, and medical across the European region. And one of the innovations is that it are mainly non-health commissioners, because at least in the region here, we used to talk to health people. We like to talk to the converted people because they say we're doing a good job. So now we became more smart, because every single sector in society is impacted by health issue now. So I asked Professor Mario Monti, previous Prime Minister in Italy, previous European Union Commissioner, to chair. And I had to convince Professor Monti really, because he kept asking, why do you ask me? I was a politician, I'm an economist, but not a health person. But I was telling Professor Monti, that's exactly why. Because you have to help the public health people with the elevator speech that I can go to heads of state, Minister of Finance, why public health investment is so important. And I'm very, very appreciative that he agreed. In fact, last Tuesday, Mario and me had a talk, very good talk, with President Charles Michel, who is the President of the European Council, who is convening frequently the 27 heads of state of the EU on this particular matter. And it was very interesting to hear President Charles Michel telling to Mario and me, the window of opportunity is closing. I mean, can you imagine? We're still in the midst of the pandemic, but President Michel of the EU was telling that we should be careful that it will not be business as usual once that the pandemic starts to become better. With Professor Monti, it's an independent commission, so it's not a WHO commission, and he decided to have 8 working groups. And one is on international governance. It is co-chaired by Madame Sylvie Goulard, who is the Deputy Governor of the Bank of France, former Minister of Defense of France, and an advisor to President Macron on greening the economy. And co-chaired by Lord Jim O'Neill, Chair of Chatham House, former UK Government Commercial Secretary to the Treasury, and also a chair of the review on AMR, antimicrobial resistance, and with a strong support also of Dr. Oleg Salagai from the Russian Federation. The particular concern of this working group is the system of international governance, but not only with respect to health and crisis management, but more broadly, affecting climate, biodiversity, and the environment. What the group, it met 2 times, some of the points mentioned is that there are these international commitments and declarations, but very few tangible results. So it leads to exasperation by the citizens and a lack of trust in experts and elites. And this is one of the issues I asked the Commission to look at, because in our region, we see a big schism between the scientists and the politicians, and scientists who want to play politicians and politicians who want to play scientists. And we have to bring them together. So we want to ask the political leaders really how to close this gap. So this also means I should start with my own organization, WHO, which comes to the independent panel for pandemic preparedness review, IPPR, and WHO reform. So also WHO is asking and being asked by member states to ask this question: is WHO fit for purpose? Is WHO adequately financed and empowered? At the regional level, we are trying to take this forward through the European Programme of Work in line with the general Programme of Work globally and asking these questions. So, coming back to the first results of the working group on international governance for health under the Monti Commission, I would like to share 4 of the initial streams of thinking. And remember, this is mainly non-health people, but high-level non-health people. The first initial stream of thinking is it should not be assumed that there will be greater cooperation after the COVID-19 pandemic. We should be very realistic in this. It may well have an ambiguous effect on global cooperation because we see that the response to the pandemic has also involved a set of nationalistic actions, such as closing the borders, encouraging a reshoring or at least regionalization of global supply chains, which may encourage unilateralism and narrow nationalism. In fact, I was giving the interview for the Danish TV yesterday evening, and they were asking 95% of the 23.5 million doses of COVID-19 are concentrated in 10 countries globally. There are about 45 countries which started mass national vaccination campaign, 38 high income, 6 middle income, and only 1 low income country. So we have to be realistic. Second initial stream of thinking, there are lessons to be learned from the governance of climate change. And this is a richness of the Monti Commission, that we have a lot of expertise outside health. Because for governance of climate change, there are subnational and non-state actors, such as cities, businesses, investors, and civil society, who have played an enormous significant role alongside national governments and international agencies. So we need a different partnership model of governance. Number 3, the third initial stream of thinking, is the extent to which the international health regulations have proven adequate or less adequate to the challenge of the current pandemic. Concrete, if you have a country which, is not following, let's say, the rules of the game, I mean, WHO definitely, we don't have the teeth yet, right? That's what the IPPR and other mechanisms are looking at. WHO can do more, but WHO is as strong as the teeth giving by its member states, which is the World Health Assembly. So there, the World Health Assembly, the member states themselves have to decide how strong do they want WHO to position itself. And the European Union, under the German EU presidency, supported by France and ultimately the EU, came out with straightforward council conclusions how to strengthen this role. And then finally, the fourth initial stream is to take lessons learned from other fields of international cooperation, such as that of the enforcement of international law, recognizing that health is more than human health, meaning One Health. And there is also a working group under the Monti Commission dealing with this whole issue of One Health. These are still early days in the Commission, so we will be very keen to keep all of you informed. But my final point is coming back to the first point. The pandemic has really confirmed the notion that disease knows no borders. Our destinies are intertwined, really. So I'm very much looking forward to the wisdom of the other panel members and the people who are linking in here. How can you really achieve a more resilient society to leave no one behind? Thank you.
Thank you very much, Hans, and thank you for highlighting a number of issues that have come to the fore that I would just like to reiterate also as lessons. One is that when we speak about the health system, we increasingly have to integrate the social care system, particularly in the countries that have a high elderly population. And to some extent, it also means including the education system, because we see how strongly, the institutions that take care of different groups in society are affected by the pandemic, and how much we have to ensure that these institutions are safe. So you mentioning, this coming together of health and social care, and probably I would add education, is absolutely critical. Your second point, which has been a learning everywhere, I think, is the need to really involve, talk with, discuss with the non-health sector. I mean, for decades, we've been saying this, many of us have been saying this, but it's never really taken hold as much as we would have liked. And so I think, that's a message we're, I'm sure, going to hear from the others. And your point about the stakeholders is very important. If we see how much the pandemic hits cities, and the fact that we had not, systematically worked with cities to prepare them for such a global pandemic. I went back to the political science literature on global cities, and there was practically no talk of a potential pandemic and the role of cities. And then your very important point, which I call the point about the Anthropocene, that we really are in a new phase of our world's development, where the environment, health, economy, all these areas interface in totally new ways. And I'm sure Dr. Suzuki would agree how much we have discussed in the Global Preparedness Monitoring Board, the links between the environmental issues and the pandemic issues, and the zoonotic dimensions of this linked to climate change, and so much else is important. So I'd like to highlight that as lessons that we will want to take from here, and with great thanks also to this extraordinary work of the Monti Commission. Two questions to you, Hans, as a follow-through. One is also from one of the audience members saying, how do you see the discussion of the international health regulations continuing? There is work going on. Maybe you can share a bit of that, how WHO is approaching this, and what issues are emerging. I remember some of the issues after Ebola, which were sadly not taken up. So it'll be interesting to hear from you. And in a way linked to that, you mentioned your discussions with Charles Michel, the president of the European Council. He has suggested a global pandemic treaty. And that, of course, to some extent interfaces with the IHR discussions. And so if there is already now something you can share about the idea behind this global pandemic treaty, and how WHO and the European Union might work together on this. And it seems to be, maybe you want to comment on this, that the European Union is getting more active globally than it was in the past. Is that something that could be an important signal also for other parts of the world? Hans, over to you.
Thank you, and thank you to the colleagues who asked the people asked the question. On the IHR review, yes, this is ongoing work, just like the IPPR is proceeding. And I think you're right, Ilona, these are not new issues, but it's a very cruel wake-up call that it was not be taken forward. And this can go, it's, how should I say, I had this discussion also 2 months ago with the Minister of Foreign Affairs, Mr. Sergei Lavrov in Moscow, that whatever is being proposed, that it has to go through the established consultative bodies. So the United Nations is the platform for that one, acknowledging sometimes it goes a bit slower than we would like, but at least if something comes out from the UN, there is a legitimacy. And of course, we always see this tension between how far certain countries want WHO to go. There are a group of countries which think it's more a matter of implementing. The IHR should not per se be revised. It's the implementation which lacks. And other countries who go a little bit further, like for example the bloc of the EU, that the WHO should be empowered more independently when there is really a perceived non-adherence to the basic principles, to go to a particular country and do a more independent assessment. Of course, I acknowledge very much that this has to do with the national sovereignty, but like I was mentioning, a number of other sectors have reached a point on that one. I would say on the Global Pandemic Treaty, that is work being led directly by Dr. Tedros and Dr. Mike Ryan. Of course, we're very much, we have a group which is called GPG, Global Policy Group, the 6 regional directors with the DG. And I think that's something which really nicely came together also in the pandemic, that there is only one WHO. We have this uniqueness of being a federated organization, Geneva normative, regional offices action-oriented, and then the country offices. But the let's say the command and control in pandemic is very clear, and I think it works well, can always be improved. So the message to President Charles Michel, and he agreed on, is that if there would be let's say a treaty, a global pandemic treaty, that it will be done within the WHO framework in line with the international health regulations, because we would not like to see, of course, that there are independent sub-regional fora going, let's say, themselves, and then one piece in the world declares a public health emergency of international concern and another piece. But this understanding is definitely there. What I see from the maybe two final points is that yes, the EU is very committed to play an increasing role in health within the EU and outside the EU, and I think that's very, very positive, because this was, I think, almost unthinkable a couple of years ago, that there would be a discussion on a European Union health union, and I think that's great, particularly if it's aligned. So I always say a stronger EU is a stronger on health is stronger globe, and a stronger globe and a stronger WHO is a stronger EU. And then I know there has been a lot of criticism on how WHO has been handling this pandemic. I'm still very convinced that 24/7 everyone gave every ounce of its soul, and still now to be laser focused on saving lives and helping countries. But I'm very open-minded, and Dr. Tedros as well. After each pandemic, we learn the lessons, we improve, and we have to be very open-minded in this matter, that there's things that we could have done better. But I think that both friend and enemy agrees that if there would have been no WHO, it should have been created. Thank you.
Thank you very much, Hans. Thank you for those answers. And I was thinking as you were speaking, because I was involved in the committee evaluating WHO's work after Ebola. And it was our committee that suggested this new emergency program for the WHO. And I have often been thinking, if the member states had not followed us, if that program had not been established, what is the situation we would have been in today? I don't even want to think about it. And, you know, there are still financing problems. There are many issues that one would need to take up. But it also shows WHO, and at that point, Dr. Chan, were willing to reform, were open about the mistakes that were made, and we were able to move forward. Thank you, Hans. I'd like to move on to Magda now. Magda, Hans referred to the great inequalities that we are experiencing at the global level, also in relation to the pandemic, and that, of course, is also always political and geopolitical. We've just heard that the African Union has secured 270 million vaccine doses from manufacturers. to be able to answer to some of the needs on the African continent. The African CDC has played an enormously important role. Brilliant that it was established a few years ago. So with your experience at the country level and at the regional level, can you share those experiences and lessons learned with us? It seemed at first instance Africa would not suffer so much as some of the countries in Europe and the United States did, but some of that is changing. So how is the continent responding, and how is it in your country? Magda, please.
I think first and foremost, what I could say is that we are yet to understand why Africa has been much less affected from the first wave. We don't know what's coming, but if Africa had a severe pandemic, as we have seen in other parts of the world, it would have been a major disaster, not just because of the fragility of our systems, but because of the great power imbalance and access to equipment, to materials, and now to vaccines, as we are experiencing. We have seen what it was with the accessing masks, ventilators, and now we are seeing what it is in accessing vaccines. So number one lesson, it's not that we are learning now that there is a great imbalance around the world, but this has been exacerbated and brought to daylight by this pandemic. And I would also add to this that global solidarity is something that is questionable when it comes to balancing national interests and protecting our territories, our people, and our national interests. These are some of the elements on the geopolitical and the political economy of this pandemic that we need to reflect on and move forward with. In terms of how the region and nationally we have fared, definitely the governance structure at the national level in my country failed to be enough and adequate to address the pandemic. That's the reason why I-Commission was established under the auspices of the President of the Republic, because the interministerial committee that existed to deal with crisis proven to be inadequate to address the needs of the COVID pandemic. So on the national level, definitely the governance mechanisms that existed were not adequate. At the regional level, you have just mentioned CDC, Africa CDC played a major, brilliant role, and thank God this institution was created in the aftermath of the Ebola pandemic. It has proven to be that it was necessary, and if there is one good lesson we have learned from Ebola, is that we needed a regional, continental coordinating body like Africa CDC. And on the global level, definitely WHO's role in coordinating, in enforcing the IHR has proven to be inadequate. I think ministers of health through the World Health Assembly need to go back, reflect, and then see which powers need to be given to WHO before we get to the next pandemic. We have seen how the authority of WHO has been challenged by this pandemic. We have seen our science, our evidence-based decisions have been challenged during this pandemic. This is a major lesson we have to take home from the governance and the management of this pandemic. We knew multilateralism was under threat, and the pandemic just showed us, confirmed that indeed multilateralism needs to be reinvented, needs to be revisited. Multilateralism needs to be reaffirmed, and we need the solid foundations. We need to revisit the foundations of multilateralism. What it is that the different organizations that come together through the state parties to decide and agree on policies to be implemented in the countries. How should they work from now onwards? The multilateralism, the way we have known it, is no longer fit for the world we are living in nowadays. And for me, this is an important lesson. The third leg of the lessons I want to mention is in the big context of inequalities, gender inequality also was brought to daylight as indeed a space where we need to work faster and harder than we have done in the past. We have seen how much violence women, young girls did suffer through the pandemic. We have seen that the health system, the backbone of the health system, we knew this, we have the statistics. It became daylight evidence that women are indeed the backbone of the health systems. They bear the hard burden of this pandemic. We need to work on the paid wages. We need to work on decent work for women. We need to work on gender equality if we are going to face the next pandemic better prepared. We have also had good examples of women leadership in some countries, ecosystems and places, institutions responsible for leading actions about the pandemic. And we have seen that women leadership can make a difference because of the multi-dimension they encompass when they are leading institutions, countries, and places. I want to touch, as part of another lesson, on the issue of the One Health. One Health, to me, needs to stop being a department or a task force in our institutions to become a true force, driving force for us to get prepared for the next pandemic. Unless we really work seriously with the environment, agriculture, the vet services, climate, people, and the human health, animal health, and the environment become the three pieces interconnected, we will miss the next pandemic again until it is too late. One Health should stop being a nice word for politicians to have on their statements and become a discipline where we need to work from today on and then get the start preparing for the next pandemic. I think for us at country level, if I come back to where I'm working, like I said, governance-wise, it became clear very quickly that we needed to change the governance mechanism for the pandemic. The other important lesson we have learned is about public-private partnership. We have learned that the public sector alone couldn't deal with the pandemic. We had to bring in private laboratories to expand the capacity of testing. We had to bring in private hospitals to expand our bed capacity to admit sick patients. And we had to bring in the mobile companies, private institutions, schools, etc., to be able to manage the pandemic. There is no way a state or a public sector alone can deal with such a mass disruption on the economy and social community structures as COVID-19 did. The final point I would like to say, Ilona, is that pandemic preparedness, in my perspective, is a neglected global hazard. Neglected global hazard. Pandemic preparedness, the moment we deal with the last patients the last infected patient, or we bury the last dead of an epidemic, we go back to business as usual. We mention the importance of preparedness, but we never do what needs to be done so that we are prepared. So it is a neglected area. And I say it's a neglected global hazard, because the moment one country, because of the lack of preparedness, gets an epidemic going, we can see it can become a global challenge and threat for everyone. Ebola wasn't the kind of COVID the world could see. We didn't know 2-3 years later we would have COVID on the global north more than in the global south. I think this is a good moment for us to reflect on how can we bring the balance between the two sides of the hemisphere, and understand that until everyone is safe, no one is safe. I will stop here with my reflections, and happy to answer any question. Thank you, Ilona.
Thank you so much, Magda. And I'm going to come back to a number of questions and also highlight the common issues that both you and Hans have picked up. But since Hans has to leave us in a minute, I wanted him to respond on the one hand to the gender issue that you raised, how much that is also an issue in Europe. And the other thing is about learning. One of the things we have read most frequently is, and this is also already a message into Dr. Suzuki's presentation that you won't be here for, Hans, is that so many commentators said, why was Europe not willing to learn from others? Why did it not look to Asia? And Magda, to some extent, referred to that as well. Who is ready to learn from whom? And do you see some pattern there? Do you think some improvement, some work WHO also needs to do there? Hans, please, before you leave.
Thank you, Ilona. So on the gender, absolutely. And thank you so much, Doctor, for mentioning this. If I, for the sake of time, would like to pick out one issue relevant to what you mentioned there, it would be on the informal carers. In the European region, we have I mean, the largest, let's say, social workforce are informal carers. Daughters-in-law, spouses who often have to leave their job to take care, particularly as in Europe, we were, I mean, really left the elderly people behind in the first wave. And those people are often vulnerable themselves for health issue, or not recognized, but this now becomes more and more. So absolutely. That's why we have within the Monti Commission a specific group on gender, which is co-chaired by the first female president of Finland, President Tarja Halonen. And then on learning, yes, because this was a big lesson in modesty, Ilona. We had EU countries, without naming them, and we know, right, with, I mean, relatively, I would say, relatively strong health systems, which were, I mean, completely overwhelmed in a couple of weeks. So in that sense, I come back to my point that I have great relationships with the regional directors of WHO in your regions, Dr. Moeti, Dr. Takeshi, and we are organizing bilateral or trilateral workshops to learn from each other. And I strongly believe in this, that every single country has something to learn. There is no any country which only can teach. And finally, my deep, sincere apologies that I will have to phase out, because I was really looking forward also to the perspective globally and of Japan. But Ilona, please keep me informed afterwards what comes out of our respected next speaker. And the reason I tell you transparent why I'm going out is my first VC with the new Minister of Health of Israel, which of course is very important also for our region wide. But thank you so much, a fantastic session, and my full respect to everyone.
Thank you very much, Hans. Thank you for joining us, and good luck with the session. Everyone's looking to Israel right now because they are so successful in vaccinating their population. And of course, a lot of lessons to be learned from Israel in terms of the importance of universal health coverage and a digital healthcare system. So I think we will look forward to that learning. There's a question from the audience also saying, we've talked about public-private partnerships, and you have also highlighted that. Hans has now highlighted, the informal care workers, etc. But in many countries, there are large sections of non-profit organizations, of civil society organizations, etc. How are they involved in your work, also possibly even in your commission, or how is the dialogue with them, and is that working well? Must it be improved? What are your views on that, Magda?
Thank you for that question from the audience. The civil society organizations, non-governmental segments of of our country have played a massive, huge role in reaching out to the people, particularly the communities at the end of the road, with messages, with care, with contact tracing, with support, with food. When lockdown was prevailing, people were really left with nothing. North African countries, as you know, adopted lockdown measures, but very soon it became clear that they weren't sustainable because people can't keep a lot of food in their fridges, in their kitchens, in their houses. So day-to-day fighting for subsistence, for food, was a challenge. And these organizations played a major role in supporting communities and feeding the community resilience. I can even mention that non-governmental organizations were so helpful, including on the human rights side. We have seen police violence. We have seen a lot of challenges to human rights. And these organizations stood up to protect, to sensitize, and to make sure that the measures would be commensurate with the challenge we're facing, but protecting the rights of the citizens. So we wouldn't have been able to make it without civil society organizations and NGOs. Definitely both local, national, and international organizations from the civil society side of the response. Yes, very important.
Thank you, Magda, and thank you for highlighting that so extensively. I just came from a meeting with UHC 2030, and we were discussing the important role of civil society, and that in some countries, actually, because of the government response to COVID-19, the space for civil society has actually narrowed. And of course, in some countries, there have been serious, you alluded to it, human rights problems, and therefore, the role of civil society, those courageous voices, not only in terms of, the service that they give, the support that they give, and thank you for mentioning food. We often forget that. And on the other hand, their advocacy role. One more question before we pass on to Dr. Suzuki. Give us a better, because our session is about governance, can you give us a better feel for the High Commission? You said it was specially established because the existing governance mechanisms weren't sufficient. Can you tell us who's in that commission, what powers that commission has? because it might be something interesting for our audience if they compare it to the governance structures in their own countries.
Thank you. Thank you, Ilona. Let me just add something which I think is important about the civil society organizations, particularly the ones in my country. The youth, the women, were the driving forces behind the civil society organizations. Some associations and groups were established specifically to deal with COVID. The power of the youth, the power of the women was really powerful, really great to push sensitization and help us with the pandemic. Going back to the High Commission, the High Commission was established by the head of state to bring one voice to the response, to improve coordination, and to ensure that the whole of government will respond, but in a coordinated manner from the top. We have a coordinating body, the National Coordination of Pandemics, of Epidemics, that is under the Ministry of Health. Technically, doing the work, it was found that going through the minister, then to the prime minister, and get the actions implemented was too slow. And by the time it gets to the other ministries to be involved and execute the actions, it was often too late. So it was felt that there was a need for an institution coming from the top. Who's here? Technical people, experts on disease prevention and control, on epidemics. We have a close collaboration with the UN, WHO, UNICEF, who second their experts and their consultants to work with us. And of course, we have a huge logistics support from World Food Programme, procurement, human resources, because there was a massive mobilization of technical people, health workers to work on COVID. So this is what the High Commission is all about. It's about technical, strategic operations and command and control in a coordinated manner.
And it has a strong woman in charge. So great. So let me move on to Dr. Suzuki. Thank you for being so patient as we move through this discussion. I would have wished if Hans could have stayed on to have some more discussion about the interface between, the European lack of modesty and the Asian experiences that were there to take up. But over to you, Dr. Suzuki. What are the main lessons that you would like to share with us, perhaps both globally, regionally, and at the national level of Japan?
Thank you, Yona. I will be touching upon 4 brief issues for the sake of time constraints. First is about the GPMB, Global Prepared Monitoring Board, its role and findings. The second, the role of transparency and trust in global health governance. Third is the multilateralism and unilateralism in health governance. The last one is the how to secure equitable access to public goods for health. First, about GPMB, it's established in 2018 May. It's an independent monitoring board to ensure preparedness for global health crisis, and convened by the World Health Organization and the World Bank. And as you know, Yona, we have established 2 reports. One is 2019, the other one was last October. And the conclusion of the second report, I would say, they have the recommended 5 urgent actions to be taken to bring order out of the catastrophe or chaos currently faced by the COVID-19. One is the responsible leadership. The second one is the engaged citizenship. And the third one is strong and agile systems for health security. The fourth one is sustained financial investment. And the last one is robust global governance of preparedness. I would highlight in this connection 2 issues. One is the financing security. As you know, WHO has established the CFE, Contingency Fund for Emergency, which has the short time frame up until 3 months. It has quite flexible usage, but the limitation of CFE is that it has only the very limited number of voluntary donors, such as UK, Germany, and Japan. On the other hand, we have World Bank's Pandemic Emergency Fund, PEF, sorry. It has very long-term vision, but it has a very stringent condition for disbursement. As I recall, it has only limited history of disbursement. So I would say that we cannot rely on the very limited number of voluntary donors for WHO's fund. So I would say that there has to be a very close linkage between WHO's fund and the World Bank's fund, such as the automatic replenishment from the PEF World Bank to WHO if the level of amount will be drying out on the part of WHO. The second issue is the international sharing of pathogens. We do have a Nagoya Protocol. It's guaranteeing host nations' sovereign right to allow or not allow the movement of cross-border movement of plants or animals, microorganisms. And it's very good for preventing extinction of species. But in case of global level pandemic, I think we need to have the direct access to the laboratories and with the R&D capacity. So there has to be a loophole. We do have one loophole, which is the PIP framework, Pandemic Influenza Preparedness, but we don't have any other such instrument. So I think the world, especially the World Health Organization, has to work on this area to prepare international coordination mechanism in this regard. Second issue is the transparency, role of transparency and trust in global health governance. I would say that before the introduction of very effective therapeutics or vaccines, only the changing behavior of the people would save or control the pandemic of spreading pandemic within the country. So we have to have the changing behavior of persuading people. But in order to persuade people, you have to have the transparency on the part of the government, that people would feel that government is not hiding anything, government is not moving behind their backs. And the trust in scientific evidence and the trust in the government ability to transform the science into practice will be very important. Third issue is the multilateralism and unilateralism. I think one of the issues we have to reflect upon after the COVID-19 pandemic is whether or not we should limit the international trade or movement of people when the pandemic hits the world. I would say if we allow each country to have its own unique standard for quarantine or shutting down the border, then it will be leading to the unilateralism or the range of retaliation, or some country might hesitate to report cases to WHO, fearing the trade will be stopped. So I would argue that we need IHR type of legally binding mechanism to specify the acceptable level of protection and legitimate actions for cross-border interactions. The last issue is the governance mechanism for public goods for health. I think there are two issues. One is the PPE, personal protective equipment. Every country was lacking the PPE in healthcare setting because the demand is surging, but on the other hand, the import is very limited. So I think in order to ensure the equitable access to the very essential goods for health is very important. The other issue is the ensuring the access to vaccines and therapeutics. Um, I think nobody can blame the country to try to protect its own nation by securing certain amount of vaccine and therapeutics. But as Magda mentioned, I think no country is safe unless every country is safe. So we do have to have the mechanisms such as COVAX, which would allow the access to vaccines or very important therapeutics for potential less affluent countries with the help of other countries. So these issues can be only resolved, I would say, by the multilateral global coordination. So I think that's very important. So those are my issues. Thank you.
Thank you very much, Dr. Suzuki, and thank you for that focus also in a way on very concrete governance mechanisms. And to some extent, I'm not sure if the analyses of Charles Michel is correct. The window of opportunity is closing. That we feel, as bad as a crisis is, at least let us use it to improve governance. And you've indicated actually a number of critical areas that need to be put into place in terms, one should say, actually of international law. And that is truly important. We've seen already how the move of South Africa and India at the World Trade Organization in relation to the waiver on vaccine IP is leading to tensions even before there is a new director there, which indicates how much the World Trade Organization is also involved in this. And there have been suggestions that some of the sanctions one doesn't have now might actually be sanctions through the World Trade Organization rather than through other bodies. So can I ask you then all these incredibly important moves in terms of governance, in terms of global health governance, and of course, financing is part of that governance. And I'm aware of a number of the things that have moved or have been tried to move within the G20. Where is the position of the Japanese government in this context? What things is Japan pushing? I spoke about UHC 2030 earlier, where Japan made such a tremendous difference in global governance. It obviously also made a tremendous difference when the Global Fund was established. It introduced this important notion of human security. And I think it was Magda who said we've got to expand this notion and include sort of planetary health. Could you give us some idea of Japanese leadership in this area?
I think the global health issue is one of the few options we do have in our diplomatic tools, because we do have a very limited military policy or military coordination with other countries. And as you mentioned, universal healthcare and human security are two issues we are pushing forward for the last 2 decades. And I'm pretty sure that the current and the last prime minister and the current prime ministers are very much behind these initiatives and will be helping and assisting other countries in this regard. Because somehow the other countries, including United States and some European countries, are very busy in their own domestic issues. So we do feel our responsibility to cover those issues in the area that other countries facing some difficulties. Thank you.
Thank you, and I think the world will be very thankful for that. Can you also share with us, Dr. Suzuki? We've heard about the African Union, we've heard about the European Union. There's no equivalent of that type on the Asian continent. But could you say a word or two how Asian countries, obviously Asia, very different parts of Asia, Southeast Asia, other parts of Asia. But how is the cooperation between countries in relation to COVID-19? And do organizations like ASEAN, APEC, etc., do they play a role?
Yes, we have proposed the establishment of Asian CDC following the success of the African CDC and working with the ASEAN countries, especially Vietnam and Cambodia. And so I think this is a very important issue, perhaps working with China and with United States, and best how to provide the best assistance to these countries, whether it's a laboratory issue or surveillance or epidemiological issues or establish the vaccine factories, or these are the options we could explore in the coming years.
That's a very interesting concept. And we're seeing, the regional CDCs are becoming more important. There's discussion in Europe to actually strengthen the ECDC, the European Centers for Disease Control. There was mention, I think, Hans alluded to it, the European Health Union wanting to strengthen the health responsibilities of the European Union. Is there a similar discussion in Africa, Magda, to have more health responsibilities, more action on health in the African Union?
Ilona, as you know, the African Union itself has a Department of Social Affairs where policies on health matters are taken. I believe as Africa CDC matures, it will expand to include the health priorities that are dealt with right now by the Social Affairs Department of the African Union.
Thank you. Dr. Suzuki, please.
Yes, I think it's very important to recognize for the last 20 years, the most pandemics are originating in Asia. Avian flu, H1N1 influenza, and SARS, and this COVID-19. So I think it's very important to recognize the small size of the epidemic as early as possible and try to figure out the R&D, stimulate the R&D activities in Asia and other parts of the world. I think that's very important.
Yes, and you mentioned the scientific part of this, how important the whole issue of sequencing the virus has been, both the initial sequencing, but now with the mutations, and actually also seeing that some of the most developed countries, take Germany, my country, is very bad at sequencing, for example. And therefore, certain strategies are not even possible because you don't have the information base. Could I ask both of you a general question on this, because we haven't focused so much on it? What role does digitalization play in all of this, both in sharing of information, misinformation, public health data, and what are maybe gaps that you feel in terms of governance need to be addressed here? Would you want to start, Dr. Suzuki, and then Magda?
Yes, I do recognize that the number of patients and number of deaths in East Asia is very much limited. And so we do regard East Asia as successful in the control of pandemics. But at the same time, we do recognize in some countries like South Korea, Singapore, and region Taiwan, and these are the very success. And the key to success in these countries or region is that they use GPS to control the pandemic, especially in young patients. They don't have symptoms, so they have to stay at home without symptoms. They have to stay it for 2 weeks. But if you don't use the GPS, you do have to make a phone call to recognize they're there. But if you do use the GPS, you could have the digitalization mechanism to recognize where they are. So these are the issues to save the human power resources And that's one of the key issues to ensure their success.
Thank you. Magda.
Thank you. Digitalization has been one of the major successes of the High Commission in dealing with this pandemic, not at the level of what was mentioned by Suzuki, but our health information system was 100% paper-based. And of course, having accuracy in terms of the data and the real-time follow-up of contacts required that the data was immediately available. So we went on to digitalize our systems, both from the lab to the clinic to data collection. And that is one of the main reasons why we have been able to go after the pandemic, get the cases, identify the infection, the points of transmission, and be able to manage it. Digitalization is here to stay, and that's the answer to many of the challenges we have in handling the pandemic and other challenges in the health sector. We hope to be able to expand it to other diseases. We are using the DHIS2 platform, and we believe we can do the same for HIV, for tuberculosis, and then strengthen the system, the health information system. Yes, a real success and very much indeed needed.
Thank you. And I think that's an important thing to keep in mind also in terms of our audience, that nearly all the issues that we've discussed relate in one way or the other to the potential or the application of digital means. Please, Dr. Suzuki.
Thank you. You mentioned that we need to learn from other countries to improve our programs. I think before we start learning from each other, we have to ensure one thing, which is the data compatibility. Because as I understand, when we try to compare our data with other countries, we do have the issue of comparability, because case definition is different. Some countries do not count the homebound patients. And for the mortality, we do count the patients with the PCR plus, even though they died from traffic accidents. But some countries do count when the COVID-19 is the direct causes of death. So these type of small differences will be very important when you compare the differences between the one country to another.
Yeah, thank you very much for that. And that, of course, is a big challenge also to the World Health Organization, that we develop that data comparability. And obviously, all kinds of organizations are developing all kinds of data sets and calculations, and mathematicians seem to be more important right now than public health specialists in doing predictions. But it all starts and ends with reliable and comparable data. And so even in the best digitalized system, if we don't have those comparable and reliable data, we are sunk. And therefore, they become an incredibly important governance tool, governance instrument. And I think in the governance discussion, and I'm so glad you raised this, this is often neglected. So we are now nearly at the end of our time. I think we've had a really exciting discussion with input from the three areas of the world, the three regions of the world, a better understanding also which are the key governance challenges that the speakers do see, with some significant overlap. And I also think some additional components that maybe might not have been in the focus initially. I've been asked by the organizers to try and summarize that a little bit, which will be near impossible, but I'll highlight one or two things. one that in a way is above everything, I think, and that was mentioned by many of you, also you, Dr. Suzuki, in particular, the issue of transparency and trust. So at the basis of any, if I use the simple term, good governance at any level is transparency and trust. And I would probably add accountability, and that can be linked to transparency in many ways. And we have seen that in many countries and in many organizations also in this whole context, that was not sufficient. And if there's no transparency, you don't get the trust. Again, if there is no real accountability, you also do not get the trust. And we are going to see, I think, in the aftermath, whenever that is, of this pandemic, that many more national commissions are also going to be put in place to actually explore that. We heard that we need to revisit the foundations of multilateralism. Magda referred particularly to that, and you, Dr. Suzuki, also underlined the many new instruments and mechanisms one would have to consider if we want to be prepared seriously, and if we are able to finance both preparedness and response. And so I think that will be an incredibly important discussion, also in the context of the present power spectrum in the international arena. I mean, one of the reasons global solidarity has been so low in general is that because one key actor, the United States, did not contribute to the multilateral system. We will have to see, in what way that can be picked up also through many different mechanisms, G20, UN, WHO, etc. But I think there'll be a big challenge for other countries to actually help deal with the decoupling in the global health system. And that I often say, how well we have been, if we look historically, how the USSR worked with the United States to eradicate smallpox. We really need to bring the two big players together again in the multilateral system so that we can move forward. All of them, of course, also work bilaterally, and we have vaccine diplomacy and mask diplomacy and PPE diplomacy and all kinds. But that revisit the foundation of multilateralism, I think, is important. And the third big thing I think I would like to highlight is, and again, Magda and Hans both alluded to it, we need to think this whole pandemic story, the narrative, much more broadly. We need to have a better and broader understanding of One Health, that it doesn't just mean, oh yes, please think about humans, animals, and plants, but really in this notion of a broader preparedness, which takes us back to Dr. Suzuki, that and also the Monti Commission, that we have to learn from instruments and approaches in other policy arenas and also bring them together. And that's perhaps a good point to end, because this year there will be many important COPs, more related to climate, biodiversity, and nature in a sense. And we need to ensure that that health dimension is there, that the biodiversity discussion includes the sharing of pathogen issues and all these kind of aspects. So where again, then we come back to revisiting the foundations of multilateralism, how we get that better cooperation in global governance that all of you have indicated. My last point before I give some briefings I've been asked to give is, I think Hans used the term lessons in modesty. I think all countries have, in some way or the other, have learned that, or at least should be learning, a lesson in modesty, and how that international learning is so important, and that the knowledge no longer flows automatically from the north to the south, but that it's a much broader quilt of knowledge and experience that needs to be shared in new ways, and where much more respect needs to be given to everyone that contributes. So I'd like to thank you very much, Magda, Dr. Suzuki, and Hans Kluge in absence, for your contributions. And thank you to everyone and to the organizers. Goodbye. Have a good morning, day, afternoon, evening. Bye-bye. Thank you.